This is Dr. Charlotte with Peak Movement Physical Therapy. In this video, we're going to be going over how to do some rotator cuff exercises. So some just banded internal, external rotation of our shoulder. So if you have a TheraBand, you can anchor it to something, or my favorite and most convenient way is to tie a knot in the end of your TheraBand and shut it in the door. So you want that TheraBand to kind of be even with your elbow when your elbow is at your side here for this exercise. We're gonna focus on internal, external rotation just at our side, which is kind of the starting position for a rotator cuff rehab. We start at the side and then we'll come up to 90 degrees of flexion and then out to 90 degrees of abduction, often known as 90-90. But to start, we wanna be able to activate our rotator cuff in its most safe position, which is at our side. So to do this exercise, I want you to really focus on the muscles that you're trying to activate. So in the back, we have our infraspinatus, our supraspinatus, and then our teres minor. Those are gonna be our external rotators of our shoulder. So as I'm doing this exercise and I'm coming out into external rotation, imagine that these muscles are pulling the arm out into external rotation. You really shouldn't feel much in the deltoid when you do this exercise. If you feel it in the deltoid, that means that you're overloading your rotator cuff and you're just using your deltoid, which is a common compensation pattern that we don't want to reinforce. So really kind of imagine those muscles activating, contracting and pulling that arm out into external rotation. So standing up nice and tall, shoulders kind of up, not super engaged down with our scapulas, but just kind of in a good postural position. From here, tuck your elbow into your side, thumb up towards the ceiling. You're gonna start at your tummy. External rotators are generally pretty weak on most people, especially if you have shoulder issues. So start with a little bit of tension on the band, but nothing like out here. From here, starting at my tummy, standing up nice and tall. Imagine you have a rotisserie chicken pole going through your shoulder and you're just rotating around that. I'm not moving a lot in my shoulder blade. I'm not engaging my pec or anything. I'm just standing up nice and tall, just purely rotating in that shoulder joint, using my external rotators to pull that arm out just to about 45 degrees, slow, controlled back in. Pulling the arm out, using the back of the shoulder muscles, our rotator cuff, slow, controlled, back in. Now for internal rotation, if I wanted to work the same shoulder, I'd just turn around, but you're gonna get in a similar setup. So elbow tucked in at your side. For this one, to use the full range of motion, you are gonna start with your hand a little bit in this 45-degree position, and then from here, I want you to think about using your internal rotators for your rotator cuff, which is your subscap, which is just on the front of our shoulder blade here. Really try to not use your anterior deltoid or your pec as you come in. Really focus, rotisserie chicken pole. I'm rotating just in this joint, starting at this 45. I'm gonna come in. Elbow's gonna flare a little bit, that's totally fine, but my shoulder blade is staying stable. I'm doing controlled in and out movements. I'm not just letting that band pull me back. And I'm really thinking about using the muscle kind of high up in my armpit to do this motion.